But it is great to be with you today. As you say, it's a tiny bit busy, but it's as a consequence, I can't, I'm afraid, stay for the whole of the sessions today to hear all about your innovations and the great work that's going on, and to hear what Tim and Bola are going to say. But I have read a summary of some of what the programme has achieved in the past and what the colleagues who are joining the programme have done and are planning to do. And I have to say, it is really exciting reading. And certainly from my point of view, I would say there are people who say that the NHS is not good at this sort of thing. They say, you know, it's monolithic, it's stuck in its ways, people are too deferential to hierarchy, an established way of doing things. And I've heard people say that the NHS actively resists outside ideas, you know, not just from industry and innovators, but of course from other NHS organisations as well. I think they are wrong, people who say that. And I think they are wrong because although there are certainly challenges to get over or around on the road to adoption and spread, in my experience, when I go out and about and talk to people, as I do a lot, I have to say I see no shortage of willingness and no shortage of active willingness and active thinking about how the NHS can best change and adapt, and how the NHS, parts of the NHS, can learn from other parts. So everywhere I go, I meet people, honestly, from like ward to board, who are excited to tell me about the next big thing in their field or an idea that they've had and are implementing to make things better in their individual service, their organisation, their place. And if you look back over the last 73 years of the NHS, that I think has always been the story. We've been at the forefront of medical advances throughout our history. Think intraocular lenses, think total hip replacements, think IVF or robotic surgery, genomics, gene therapy. So the NHS story is one of constant change and adaptation and constant innovation. There's no doubt, though, that the last couple of years have been really, really difficult for frontline teams. But certainly, I think the other side of that story has been one about a real showcase for how frontline colleagues and the systems that support them can work and have worked with industry, with academia, with each other over large geographies as well as locally, to rapidly develop and spread new tests, new treatments, new processes. So we have shown in the last 2 years, even more than in the previous 71, that truth that the NHS absolutely is an organisation that continuously changes, adapts, innovates. But we couldn't have saved so many lives in hospital, and we couldn't keep doing it if we didn't have that spirit of collaboration and co-production, and we didn't have a way of supporting people who are developing those new ideas to be able to take them further and then to spread them across the NHS. So where do I look? Now I look, and we all do, don't we, to the extraordinary success of the COVID vaccination programme and some of the kind of can-do spirit that we've seen both in that programme and more generally across the pandemic. And my challenge, I guess, to my colleagues and to the NHS more generally is to try and think about how we keep that can-do spirit and how we continue to build on some of the ways of working that have been established over the last couple of years, so that becomes much more that the way that the NHS works in future, rather than just something it does through a particular 2-year pandemic period. So it's a real pleasure to be joining you as you embark on the 7th year of the NIA, which is, of course, the programme supporting spread and scale of evidence-based innovations across the NHS, and more importantly, providing access for more people and helping more patients and helping clinicians do their jobs in a smarter way. I've got some stats here, which you'll be very familiar with, but I was looking them up earlier to see that since its launch in 2006, 71 fellows have been supported to scale their innovations across the NHS and beyond, with results including 2,786 additional NHS sites using NIA innovations, over 196 million of external funding being raised, over 1,000 new jobs being created, 178 awards won, and 55 of the NIA innovations currently selling internationally. So that is quite an astonishing track record for something that is, if this is the 7th year, we're still really talking about a programme that's still quite young. And of course, what that tells us is that being part of this programme is a ticket to being part of a much wider innovation ecosystem. And I particularly call out the Accelerated Access Collaborative and the amazing work that they've done, again, over recent years. And their programmes like the NHS Clinical Entrepreneur Programme, the healthcare strand of the Small Business Research Initiative, the AI Award. So loads of other pieces of the jigsaw which you are now joining. I represent NHS England on the AAC board. I say kind of ably assisted, led is probably more honest, by Tim Ferriss, who is speaking to you shortly, and of course with Matt Whitty as the chief executive. And what we collectively do with partners across the much wider health ecosystem and innovation ecosystem is work together to try and make those connections so that we are bringing the best innovations into the health service to meet the health service's most material challenges. So in 2020-21 alone, the AAC helped almost 3,500 innovators, supported over 3,700 innovations, including over 700 NHS staff as part of that NHS Clinical Entrepreneurs Programme. And just to think about impact, and just to pick a couple of points, they've helped patients spend over 140,000 fewer days in hospital and saved the NHS over £119 million to reinvest in patient care. And for me, that is the really crucial thing, because we're not talking about innovation for its own sake. We're not talking about, new gadgets or an application that looks good on paper but doesn't address real world challenges and priorities and doesn't account for real world behaviour and pressures, because honestly, that's not going to go very far and it shouldn't expect to. And that's why the approach taken by the NIA this year is so important, providing that very clear framework which tells innovators what the challenges are that we want and need help with. And that is part of a wider shift going on within the AAC, and actually it's reflected in the life sciences vision as well, to ensure industry and innovators hear very clearly what it is that the NHS wants and needs from them to improve patient care and support or free up clinicians to do what they do best, and then to ensure that the NHS is ready to make the most of what then comes through. I'm sure you're not, but don't be under any illusion that the topics we've chosen are random or they're side issues, although they're just because they sound good. Addressing health inequalities, speeding up detection or diagnosis, personalised care, these are absolutely at the heart of our mission for the future, and get those things right and so much else of what we do will fall into place. They are all three absolutely core priorities for the NHS, and they are writ large in the long-term plan that was published back in 2019, and something that we're going to be updating for 2022, hopefully later this year. They're all themes also which have come to the fore during the pandemic, and around which, as I say, we are now building our strategy for recovery. If you've seen the planning guidance that we sent out to the NHS just before Christmas, you will have seen that is very clear, that those themes come through very clearly. And what we're also doing is trying to make sure that they're reflected in each of the specific asks of the NHS. So for example, if we're talking about elective recovery, then you will read into that a really specific set of commitments around health inequalities. You will read in it really specific commitments about speeding up detection and diagnosis, and you will read in it really specific commitments around personalised care, because those are all absolutely critical to our ability to deliver that bigger elective recovery challenge, but also do it in a way that is long-term transformational for the NHS and for the people who provide care and the people who use our services. So that's why I guess I would say this programme isn't a nice to have. This programme is about us making good on our commitments. When we say those are the things that matter, and when we say we know more of the same isn't going to be the answer, both of which we say a lot of the time, we need programs like this that help us then find some of those new answers and help us put them into practice. So I believe, as I say, what I said at the very beginning, I strongly believe those who say the NHS doesn't do innovation are wrong. And the NHS does do innovation because the NHS has always needed to do innovation just to stand still and meet current demands, let alone achieve key priorities that we want to deliver for our patients for the future. And my commitment as Chief Executive of the NHS is to champion that innovation. I really enjoyed the board, the public board last week. Those of you who were lucky enough to find 2 hours to watch it would have seen that I actually demoed a couple of, or at least I showed a couple of this year's MedTech funding mandate programme kind of winning devices at the public board, including my favourite one, which is a tiny balloon that goes up your nose to deal with recurrent and acute, deals with sort of sinus problems. I won't attempt to explain the actual mechanics of how it works, although I was taken through it by colleagues. It was absolutely fascinating. But the point for me was just using that public moment to say, this matters and it's real, and we have some really concrete ways of showing that words do translate into actions. So our challenge now, of course, to ensure that the NHS adopts that at scale so that it benefits all of our patients, not just those who happen to have been involved up till now. So I hope one of the things you take away from, certainly from this conversation, is that innovation is absolutely at the heart of the way that certainly as a leadership team, we are thinking about our current challenges, at the heart of how we're thinking about developing change for the future, and I think has been at the heart of what the NHS has always been about, and that the priorities that we have been talking about really are at the core of what we need to do and what we need your help with. Tim will have much more interesting things to say, as will Bola, on digital transformation, on health inequalities. So I hope you kind of get stuck in with them to this in more detail. But I have, if I may, just want to leave you with a bit of a challenge from me. I've said what I will kind of do, if you like, for you in terms of championing innovation and supporting this programme. The thing that I would like to ask in return is for you to be ambassadors and advocates for the NHS as a place to trial and spread innovation, because it doesn't end with you. We want your peers, your fellow innovators to see the support you'll get and the success that you will hopefully achieve, and then want to bring their innovations to us too, whether it's through this programme or through other programmes that we run. So please, if that could be my request back to you, be our advocates, be our ambassadors, and encourage colleagues to get stuck in and share their innovations, adopt yours, and really take this opportunity to make true that point about innovation being at the core of what we do now and in the future. So I'll end by just saying thank you, good luck, and I really look forward to hearing about your successes over the coming years and beyond.